Thanks for joining us on This Week in Health IT Influence. My name is Bill Russell, former healthcare CIO for a 16 hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Today's show is a little bit for you, a little bit for me. I'm expanding my network here in Southwest Florida, and I met Andrew Cooper, who's the executive director over at NCH, which is one of the hospitals here in Naples, Florida. They're getting ready to do an Epic implementation across their entire footprint, and we caught up with him, have a great conversation around what they're doing, how they're planning for that, how they are thinking through that kind of implementation, especially during the middle of the COVID pandemic that is going on. So great conversation. Hope you enjoy. Special thanks to our Influence show sponsors, Sirius Healthcare and Health Lyrics, for choosing to invest in our mission to develop the next generation of health IT leaders. If you want to be a part of our mission, you can become a show sponsor as well. The first step is to send an email to partner@thisweekinhealthit.com. I want to take a quick minute to remind everyone of our social media presence. We have a lot of stuff going on social media. You can follow me personally, Bill J. Russell, on LinkedIn. I engage almost every day in a conversation with the community around some health IT topic. You can also follow the show at This Week in Health IT on LinkedIn. You can follow us on Twitter, Bill Russell HIT. You can follow the show This Week in Health or in HIT on Twitter as well. We've got a lot of different things going on, and each one of those channels has different content that's coming out through it. We don't do the same thing across all of our channels. We don't blanket post. We don't just, schedule a whole bunch of stuff and it goes out there. We're actually pretty active and trying to really take a conversation, in a direction that's appropriate for those specific channels. So we spend a lot of time on this. We really want to engage with you guys through this. We are trying to build a more broad community. So invite your friends in to follow us as well. We want to make this a dynamic conversation between us so that we can move and advance healthcare forward. Just a quick note before we get to our show, we launched a new podcast, Today in Health IT. We look at one story every weekday morning and we break it down from a health IT perspective. You can subscribe wherever you listen to podcasts at Apple, Google, Spotify, Stitcher, Overcast, you name it, we're out there. You can also go to todayinhealthit.com. And now on to today's show. This afternoon, we have Andrew Cooper with us. I've started to do my networking around the city that I moved to a year ago. I moved to Naples, Florida, and Andrew is the executive director of IT at NCH here in Naples, Florida. Andrew, welcome to the show.
Great, thank you. Glad to be here.
Yeah, but we connected through Sarah Richardson. And how are you connected with Sarah?
So Sarah worked for NCH and actually hired me into my original position here.
Wow. Well, Sarah is an advisor to This Week in Health IT. She's been with us, helping us to guide our growth and direction for a couple of years. It sounds like she was integral in your growth and direction as well.
Absolutely, yeah. She was the key factor on why I chose to come here to Naples.
I'm trying to figure out why she left Naples. I guess she went to Southern California. We went in opposite directions. I went from Southern California to Naples. She went from Naples to Southern California. I don't know.
Absolutely. I think it's a win-win either direction we go.
Yeah, probably. There are worse places to be in the country for sure. So tell us a little bit about NCH.
Sure. So NCH is Naples Community Hospital. We're a healthcare system, two-hospital system based in Naples, Florida. We have a large ambulatory presence throughout Collier County and Southern Lee County as well. So a very prestigious organization, high quality, high marks in almost everything that we do. So it's a very exciting organization to be a part of.
Yeah, absolutely. So what was your path to get to the executive director of IT at NCH?
Oh, so it's, we could go back, 10, 15, 20 years here, but essentially I started my professional career off in banking and was hired right after an EF5 tornado. Wiped out a couple community banks in the area that I lived in. So I started working for them as an intern. Long story short, they offered me a full-time job. I completed school there and graduated as their AVP over IT.
Really, I'm sorry, an F5 tornado. So that must have been in the Midwest, I assume.
Yes, yep, that was in Nebraska. EF5 tornado, which, if people don't know tornadoes, is the strongest of tornadoes. So yes, obviously it was life-altering for quite some people. Quite
Yeah,
a few
no
people.
kidding. An F5 tornado. So compare and contrast an F5 tornado and Hurricane Irma.
Ooh, so I would, on any given day, I would live through a hurricane again before I would live through a tornado. At least with a hurricane, you have general idea of when it's going to come at you, and kind of, there's still a lot of unknowns with it. And hurricanes are not fun by any means, but you have a lot more time to plan and prep. Whereas a tornado, you can have a matter of seconds to get into the basement. And truly, down here, at least in southern Florida, construction, everything is designed to withstand a hurricane, and you just can't really do that for a tornado.
So a hurricane doesn't surprise you, but the movie Twister really is true. An F5 could come up out of nowhere and just take a left turn and head towards your town.
Yep, and it essentially will F5 will level everything in its path.
Well, I remember I don't know if it was an F5, but the hurricane or the tornado that hit Joplin actually moved the hospital. Think about this. It moved the hospital off its foundation, and it only moved it a couple of inches, but it was enough to condemn the building.
Yep, absolutely.
That's amazing. I can't imagine the power of a tornado. I'm sorry, I got us sidetracked there a little bit. So you were in banking. How'd you get into healthcare?
So while I was in banking, I did a lot of mergers, acquisitions, and really had gotten to a point where I had optimized, kind of done everything I needed to do for that organization. And quite frankly, I was getting a little bored. And so my mentor at the time recommended that I go back and get my master's degree, focus on my CISSP. And then she said, healthcare really needs individuals like me. And so she really pushed me to look at healthcare. So I took that opportunity, joined a small 115-bed hospital in South Central Missouri after the bank, was there for a short time, became a director of information security for a level 1 indigent care hospital in Memphis, Tennessee. And then Sarah and I connected and was offered the position here at NCH. I've had a lot of roles here at NCH. I started as the director of information security. It took over, at that time, IT was all completely outsourced. So Sarah and I were the only two IT individuals. And then over time, I've taken over all IT operations to the executive director role. And we have insourced our IT department as of 2018.
Wow. Yeah, so I did an insource. That's not as easy as what people think. I inherited an insource in that and we're talking a sizable, 10-year outsource to Del Perot, and then the CIO before me started the insource, and then I did insource. You have to build everything from scratch. I mean, job classifications, you have to build the career paths, you have to build, processes, procedures, it was amazing how much you have to do on an insource that I don't think people would be, I think people would be surprised how much you have to do.
And of all that list, I think writing 80 some job descriptions was the hardest part. Just trying to create them all, keep track of all of them. But yeah, it really gave us an opportunity to look back and say, what do we as a leadership team want to do different within IT, and kind of build that groundwork from the start. And I will say, in the short amount of time that we've been insourced, we've really built a fantastic team.
Well, so you're in healthcare now. What's the equivalent to an EHR project in banking? Is there an equivalent?
So in banking, they use what's referred to as a core system. So that is your main banking software that has everything that interfaces in and out of it. And I have been through 7, we'll call them mergers or conversions on banking software, and banking's quite a bit easier than an EHR conversion when you look at changing out the technology.
Is it really? Why is that?
Well, you don't have to worry about radiology images and how large those are, and trying to figure out how those are going to live and everything. And in banking, it's a lot more black and white. You have credits, you have debits, you have check it. Today, you probably don't have near as many check images coming in, but you're not dealing with the full body, the full human. aspect in the banking environment.
So a lot more data elements, a lot more images, a lot more distinct systems. I mean, that's one of the things I found. I did work at Bank of America and some other places, and then when I got into healthcare, I was shocked to find, 900 different applications at our health system, and then you start digging in, and you realize there's a bunch of redundancy, obviously, but each there was software written for such specific tasks within healthcare. It really was kind of amazing.
Right. Yeah, absolutely. And I think really in banking too, they were using technology a lot they had been using technology a lot longer than healthcare, and so you really had processes and you had really more applications, which we healthcare are getting there very, very rapidly.
So you're starting your EHR project. It's right around the corner. Is that's accurate?
Yes, yep. So the board approved in November for us to do our EHR conversion. The official kickoff, right now we're in the pre-work phase. The official kickoff will be the June timeframe with a June of 2022 go live. So it'd be a very quick implementation.
Wow, well. So it's two hospital system. Do you have clinics and a lot of outpatient as well?
Yeah, we have about 40 plus ambulatory facilities. Overall we have about 7,000 users in our environment. That's a combination of medical staff, employees, contractors, etc.
Are you I assume you're relying on a vendor or contractors to help you to do this?
So we are actually the EHR vendor is obviously going to help us quite a bit with the implementation. But overall, we are only pulling a very small subset of contractors. I want to say, in just a quick count, 4 or 5. And it's really to augment us where we need to be augmented. So what we're planning on doing is implementing kind of an out-of-the-box EMR, which is kind of a new technology or a new term, but really what's being delivered to us is going to be about 95 to 98% pre-configured when it comes to us, and then we just do the personalization that we need on top of that.
So and you can say the vendor, I assume you're going to Epic?
Yes, yep, we are converting from Cerner to Epic.
So you're going to stay as close to foundation as you possibly can.
Stay true to foundation is one of our guiding principles and one of the things that we talk about with the executive team every single time. And it's truly because it feeds analytics, it feeds training, it tests scripts. Everything that we are planning on doing is built into the foundation system.
Wow, that's really fascinating. So what is the challenge of trying to stay as true to foundation as possible? Do you find you're being pulled to try to customize all the time?
So, we really haven't gotten into those workflow walkthroughs and started to talk about where we need to deviate from foundation yet, but we are coming from a completely customized EHR, and that's not a reflection of the vendor. That is truly just us as an organization over the 20 plus years that we've used that technology, that we have customized it. And so my personal opinion is I think the biggest challenge is going to be getting away from customization in general and having to adapt workflows and things that we as an organization do to match what is recommended in the software.
Right. So that's really changing the culture. I mean, there's a cultural mindset that comes with customization. We did a significant EHR build out and whatnot, and the number of times you hear, yes, but we're different. And I'm sitting there going, how different can we be? There are thousands of hospitals across the country. Now I understand if we're doing something Mayo-esque or UCLA Medical Center-esque, we're doing academic kind of stuff, but the general community hospital or integrated delivery network, it really shouldn't have, I mean, this is me talking, I'm not putting words in your mouth, but it really shouldn't have to go too far outside the standard build, I guess. If you can pull it off, there's a case to be made that you should be able to run the hospital with as close to a standard build as possible.
Absolutely, and that's why it's part of our guiding principles. So the foundation system is built off of the best practices of all organizations that are using Epic. And so, whether that's Cleveland Clinic or Mayo or, even other local organizations here that may be using Epic, all that information, all their best practices go into that foundation system for us to leverage. So yeah, I think we're really excited about that because we've really felt some of the struggles with the system that we've customized over time.
So I talked to some people that when they went through this process, they ended up putting their staff on the EHR project, and then they backfilled for the existing system. And I've talked to others that essentially brought in the vendor did a majority of the migration to the new system, and their team continued to do what they were doing. Which direction did you go?
So we are actually pulling individuals into the IT department. So we are growing by about 35 to 45 individuals within the IT department to take on the conversion to Epic. And truly, Epic has given us that staffing guide of how many positions do we need during the interim, long-term as well. And really the interim to long-term, there was maybe just a few positions in there. And we know over time that there's, individuals are going to choose to leave us. And so instead of pulling contractors in that are going to take all that knowledge the minute they walk out the door, we actually just bumped up our FTE count during the implementation to ensure that we could cover everything.
What? People are going to leave Naples? I don't know what's going on. Did you set some goals for this to sort of guide the project in terms of success metrics, KPIs, those kinds of things?
So we are originally, when we were planning the project and everything, we looked at very high level, improve quality, improve patient satisfaction, physician satisfaction. We looked at those. We're currently in the process of going back and tying the metrics to that. I mean, really, it's a comparison of what can we get out of our current system as opposed to what we can get out of the new system. And so as we build out our governance structure, each of the subcommittees will have their key metrics that they track and report back to the EHR governance, the highest level governance committee in the project.
What was the primary driver to go to Epic? I mean, what was the deciding factor?
So really, we've had a lot of challenges. And again, a lot of this is because of the customization that we've done over time. And, we didn't necessarily always acquire the appropriate modules that we needed in our current system. And so we would do a lot of custom build. And so we really wanted to take a step back and say, how do we kind of set ourselves up for better success long-term? And we did a side-by-side between basically a complete new install of Cerner or converting to Epic. And really, as we got into it and looked at it, converting to Epic for us was the right decision because it has the completely integrated revenue cycle. Today, our ambulatory revenue cycle is on a completely different system, and there's some manual entry and stuff that has to occur from that. Data analytics and was very important to us, and it's not somewhere that we've gotten very far. And again, it's because of a lot of the disparate systems that we have. So, really, as we looked into it, there were so many things that really pointed to doing the conversion was the right thing for us.
Yeah. So, I was going to ask you about your projects going into 2021 and 2022, but I assume this is going to. Are you going to be doing things outside of this project, or is this pretty all-encompassing?
So this is pretty much all-encompassing, and this is on the strategic plan for the organization. As our CEO has said, this is one of, if not the top project for the next 18 months. Obviously, it was a few months ago when we talked about it for the organization. And so our current environment entered into what we refer to as break-fix regulatory only mode as of March 1st. So we won't even be investing a lot of time into building that system. Obviously, we have to maintain it. If there's regulatory changes, we have to do that. But truly, the focus starting as of April 1st will be building the Epic system out and doing the conversion.
So this is Bill Russell hitting you up for some free information. So what are you going to do for me, the consumer? I assume you're going to use Epic's tools. I'm going to be seeing my chart. And are there any other things you're thinking in terms of the digital landscape for consumers in the market?
So the biggest thing that we're doing, out of the gate is really that patient engagement. And I'll be the first one to say that not too long ago, I had to go see my primary care physician, and they handed me the clipboard that was like 12 pages long of the same information that I had just completed what felt like a few weeks ago. And so, being able to pull that into the My Chart, into the patient portal, get that information when it's convenient for me as the consumer is on our roadmap, doing the online scheduling, being able to schedule appointments, not have to call into the facilities. There's a lot of cool things that we'll be able to do long-term with integrated devices and stuff like that. But really out of the gate is kind of like for like, where can we make the biggest impact changes? And then phase 2 will be kind of the optimization, pulling in some of that other cool technology.
Yeah, I hate to do this to you, but my father-in-law actually went to one of your competitors over on Pine Ridge, and their experience was actually, from a digital standpoint, was actually pretty good. I was kind of surprised. I mean, obviously they're already an Epic shop, and a lot of it is based on that Epic foundation. So you guys will be able to catch up. Talk about interoperability on that side as well. So I assume a majority of the health systems in Southern Florida are on Epic. Am I correct?
So there's actually a big shift that's occurring right now from Cerner to Epic. And interestingly enough, the one that you're referring to is on Cerner. They're on a Cerner platform today.
Really?
Our neighbors to the north are on Epic. And so, Advent Health from Orlando is in the process of converting, Lakeland Health. There are several organizations here within Florida that are in the process of converting onto the Epic platform.
That's interesting. I didn't ask what EHR they were on, but it just felt like it was pretty smooth. I was kind of surprised. So what about HIE? What about information exchange? I mean, is there a good strategy to move information around in this market?
Yeah, absolutely. And that's, interestingly enough, tomorrow we have our executive kickoff for our team. And one of the main topics is interoperability. And, with Epic, there's multiple different ways to do that interoperability. But when we set out initially to start talking about talking about the conversion, which at this point has been almost 2 years since we started talking about it, it was the number one thing that we talked about is if we can't share information freely in the community and with other healthcare organizations, there's no point in us doing that. So we've really doing the conversion. So we've absolutely had it at the forefront. It was included in our contract for day one. And there's many different ways to do it. For us and, Mayo, I know it's well known that Mayo's on Epic. We refer a lot of patients there. We can send information back and forth real easily. And then even organizations that aren't on Epic, we're able to leverage either direct connections or through an HIE to share that information as well.
How? So, what information did you decide to bring across from the old platform? Is it the traditional PAMI stuff, or are you trying to bring as much across as possible?
So you're hitting on all the stuff that I've actually talked about multiple times this week internally for the organization. And we've not actually set our true data migration plans yet. And so that is one of the next big things for us to figure out. And, really the stance that we are taking is we have a brand new, nice, neat, shiny system. And the last thing we want to do is take information, and again, this is not a reflection of the system, but the data that's been put into that system over 20 plus years, and convert that into nice new system. So we're working to get a group together to be able to determine the quantity of information that we're going to move over, and we are going to leverage some of that HIE functionality to make sure that we can put stuff into a holding tank and actually have it ingested into Epic at the right time. But we're also doing that coupled with a full enterprise archival platform. So all of our legacy systems are going to move into that archival platform. So our physicians aren't going to have to go to 3 or 4 different applications to find all the information on the patient. They'll go to one and it'll all be listed there. So we've already signed that contract, and we will kick that project off this summer in advance of the conversion.
Just out of curiosity, your enterprise archive solution is what?
It is Triam.
Okay, cool. Well, it'll be interesting. We'll have stuff to talk about a year from now.
Absolutely. We're really excited about this.
Yeah, it'll be interesting. So talk to me about your, so I'm going to change topics a little bit here. Talk to me about your staff and and keeping them trained. Obviously, retention, I've heard this a couple of times now. It is beautiful down here, but retention in Naples is hard for a lot of different businesses. What kind of things have you put in place to keep your staff engaged, keep them trained, and those kind of things?
Sure, absolutely. So really, when we built our new IT department in 2018, we as an IT for NCH was one of the first departments to go virtual, and we actually started with testing the waters. And to start off, we had about 30% of our staff that was completely virtual, meaning they may live in Florida, but they didn't have to live in Naples and commute into a facility. And so that really allowed us to get top talent from across the United States. We have individuals that are in California. We've just extended an offer to somebody who's actually going to be living in Jamaica. And so we're really excited about that, being able to leverage the entire population and not force individuals to move here. We do have staff that have to be here on site, and the organization just made some major announcements with some changes, and it actually impacts all employees with some changes on benefits and raises and stuff like that to help keep them engaged, because it's been a challenging year for everybody in healthcare. And so our organization is really taking some steps to really improve the employee engagement as we continue to move forward. From a training standpoint, so this has been something that has been built into our plans from day one. And I can't think of a single time that we have turned down a request for someone to go off to training or to attend something, assuming that it makes sense for their position. While we were still with Cerner, we had what Cerner refers to as their just blanking on the name, but basically an all-you-can-eat training program where our staff could go and take classes, and our staff took fantastic classes and learned a lot on the Cerner system. From an Epic standpoint, obviously they'll have to go through that certification process and everything, but we really look at any opportunity, whether it's ServiceNow or other applications, to bake in training credits and really continue to advance our team's ability.
Yeah, and that sort of gets to my next question, which is, are there areas where the staff has to learn new skills or new tools that you anticipate over the next year and a half?
Yeah, so absolutely. We have, between last week and next week, we have about 30 to 45 individuals moving into the IT department. And so what we as an IT leadership have decided to do is actually go back and reorient our entire team. So all the new individuals are learning at the same time as our staff, and it's simple things like WebEx and Teams and ServiceNow and Xmatters that we use for paging, and simple everyday use items like that, on top of all the Epic training and all the new third-party training that team's going to have to go through as well.
Wow. So is orientation very different in a COVID world?
So for us, really, yeah, we used to do quite a few meetings in person, because again, we have people that are here locally, but we've gone down to probably, I'd say, less than 10% that are on site on a routine basis. And so what we've actually learned is it's much easier if either everybody's virtual or everybody's in the room. The hybrid approach becomes really, really difficult, especially, as people are having side conversations and stuff like that. So being virtual has really allowed us to be a lot more productive, schedule meetings a lot quicker than we've been able to do, or orient people a lot quicker than we've been able to.
Yeah, so your COVID journey probably wasn't as challenging as others. If you had a fairly sizable head start in terms of the remote work aspect that everybody had to do, so that I assume that jump for your health system was not all that challenging for the IT organization.
For IT, no, because even the other 30-40% that were on-site employees were still working from home on a routine basis, whether it was 1 or 2, 3 days a week. So they were going kind of through that rotation process. So they were kind of used to it. I think the biggest thing is we just made sure that everybody had the hardware, the web cameras, the monitors, everything that they needed that they didn't necessarily have if they were not 100% virtual before that.
Did you do MS Teams, or you're a WebEx shop?
So we use WebEx for the bulk of our meetings when it involves people outside of just IT. We do have Teams as well that we use for IT, but we find that people use WebEx, or is maybe a little bit easier to use WebEx for non-technical people.
Yeah. Well, if you say so. I find Zoom to be the easiest to use. But when COVID first started, it wasn't the most secure platform out there. So obviously they've made some great strides since then to shore it up. I mean, just talking about COVID, I mean, was there, outside of work from home, we had a lot of different things that went on in the hospital. Was there any interesting requests that you got as the leader of IT around, helping to keep frontline staff safe or anything to that effect?
Yeah, and first I want to start by saying that our team, the IT team, the entire organization, feel we did a fantastic job with responding to COVID. And there were items, for example, in Cerner, there's a banner bar, and it just gives basic information on patients. And there was a lot of custom build that our team had to do to say whether or not the patient was positive or if they had been tested and all that information. So it shows up at the top to be able to keep people, both keep our patients and keep our employees safe. There were, at one point, there were triage tents that are outside in the emergency department parking lots that our team had to equip, had to put workstations and make sure all that equipment and everything is out there and functioning. We had drive-through testing, and so the IT department had to put information or put systems together and stuff to be able to make efficient processes out there in the drive-through. And even myself, there were, for about a 2-week period, I was the IT representative that worked out in the drive-through so that we could help work those processes. I was here on site. And so, really, the list of requests that we got during COVID, is so long that I couldn't probably isolate many items, but, our team was able to come up with something to support every single request.
When was our surge, or did we have multiple surges? Because to be honest with you, I'm living here, and people have asked me, like, when was your surge in Southwest Florida? I'm like, I think it was when everybody else's was, but it wasn't obvious to me. It wasn't like, the hospitals were overflowing from my perspective, but you're in the hospitals. Was there a big surge at one point?
So summer of 2021, so that June, July, August timeframe of 2021 is when 2020. I'm always thinking ahead to next year with the Epic conversion. Summer of 2020 was the highest peak, the surge that we as an organization had. And of course, it's ebbed and flowed through there, but we never got near the level that we were last summer.
Yeah, we could go down there, but this is an IT show, so I'm not going to ask you about stats and those kind of things. Are you guys participating in the vaccine? I assume you're part of the vaccine rollout in Southwest Florida, as are the other health, I assume.
Yeah, absolutely. So our first initial shipment was earmarked for healthcare professionals. So I think we had about roughly 5,000 vaccinations in the first shipment for healthcare workers. Focused those, then we went to EMS. So we've helped a lot with the first responders, stuff like that. And we've had around the 1,500, 2,000 vaccinations available for community members as well. I personally have not seen us get a lot more shipments in for us to continue with the community. So I imagine a lot of that's going through like Publix, the grocery stores, the pharmacies, which just truly have more facilities, more capacity to take on some of those vaccination efforts.
Yeah, absolutely. So we'll have to see where that goes. I mean, you guys are doing an EHR plan as COVID's hitting. You're ramping up things for work from home and and other types of initiatives to support COVID. I'm just curious, what do you think the lasting impact of COVID is going to be on the way that your health IT team operates?
So we were, interestingly enough, my boss and I were talking about this just the other day, because in the middle of an EHR conversion and all this fun stuff, we as an organization have acquired another facility and are moving one of our operation facilities into this new building. And the conversation was, what space do you need for IT? And I said, I personally have no intention of bringing more staff to be on site, and really, want to continue that virtual. I know as we start to kick off a lot of the Epic stuff, typically it would be an in-person, but we're doing a lot more of it virtually, and we're seeing we get much better participation from the organization because we are doing it virtually. I think it really drove home that customizing an application is not the best thing for organizations to do, because again, we were paralyzed during COVID and had to custom build everything because we had customized our environment so much. And just today we were talking to Epic about here's all the different things that they were able to offer during COVID for people who had been aligned to that foundation system. So I think there were a lot of really good lessons learned that we may not have been as stringent on with the Epic implementation if we hadn't gone through COVID.
Well, I'm looking forward to seeing how things transpire for you guys. There's an awful lot of exciting things that come with doing an EHR project, and an awful lot of challenge, I guess is the right word. Having done these before in 3 different states, it's, there's just a lot of conversations, a lot of moving parts, and, it's an exciting time. It's an exciting time for the team, but there's an awful lot of work ahead of you. Congratulations on moving it forward, but, I have some empathy for what you're going to be going through over the next couple of months as well.
Well, I appreciate that. And I will say, a lot of the physicians said we would rather take the pain of doing an EHR conversion to know that it's going to set us up for long-term success. And I think we as an organization were all very excited for this conversion. And so us as a team, we will make it through, as we always do.
Absolutely. Well, good luck. I notice you have black hair, and you see mine's all gray. So we'll catch up with you again next year and see that talk about the implementation, how it went, and some of the lessons learned. I think it'll be a great conversation.
Absolutely.
Well, thank you, Andrew. Thanks for your time.
Thank you.
What a great discussion. If you know of someone that might benefit from our channel, from these kinds of discussions, please forward them a note. Perhaps your team, your staff. I know if I were a CIO today, I would have every one of my team members listening to this show. It's conference level value every week. They can subscribe on our website, thisweekhealth.com, or they can go wherever you listen to podcasts, Apple, Google, Overcast, which is what I use, Spotify, Stitcher, you name it, we're out there. They can find us. Go ahead, subscribe today, send a note to someone, and have them subscribe as well. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, Starbridge Advisors, Aruba, and McAfee. Thanks for listening. That's all for now.